The wait is over. An introduction to bariatric surgery options. Is lap band surgery right for me? Hi, I'm Dr. Keith McEwen. I'm a bariatric surgeon specializing in adjustable gastric banding, and I'd like to talk to you today about facts regarding your weight and your health and what weight loss options are available. First of all, facts about obesity. This has become a major problem in the United States, with over 60% of people either being obese or overweight. So things you want to think about with weight loss strategies are, have diet and exercise work for me, or would there be other options such as medication or weight loss surgery? Another question would be, do I qualify for lap band surgery? So let's look into those questions. First of all, I want you to think about the fact, have you tried other diets that have failed? Most patients I see have, and the fact is that typical weight loss for diet and exercise plans is about 10% of your body weight. So if you feel like you've failed with your diet attempts in the past, this is not different than with most other people that I talk to. You know that weight's impacting your health, you know you don't feel as good as you could, and you want to look at other options. So the question is, do you qualify for weight loss surgery? One thing I want you to realize is that there's no part of your body that isn't affected by excess weight, and this starts with things such as sleep apnea, diabetes, liver problems, digestive problems, cardiovascular disease, knee and back pain, generalized fatigue. The list goes on, and we're very good as physicians at treating these problems, but we're not very good at always addressing the major root cause, which is a patient's weight. Indiana is no different than other states in the U.S. in that weight loss has become a real problem for people, and that we have an obesity crisis with 8% of Indiana adults diagnosed with diabetes, and we have the 11th highest rate of obesity in the nation. Now, why is diabetes so important? Well, what we've noticed nationally is that there's over a 400% increase in diabetes, and what people don't always realize is that that directly corresponds with the weight problem. Now, why do I care so much about that? Because diabetes is the number one cause of adult amputation, adult kidney failure, adult blindness. 80% of patients with diabetes will die a cardiac death, and you don't live a normal lifespan. So it's a very serious problem, and what a lot of people don't realize is that losing weight can often decrease your chance of developing diabetes, and in fact, often reverse the effects of diabetes. And what we often don't realize is that losing significant weight can reverse the effects of diabetes, and many of my patients are able to get off their diabetic medications after significant weight loss. Other impacts of obesity, I think, this is one of the few things where there's still social discrimination in this day and age with the cost of healthcare and the tight job market. I think people with excess weight are discriminated against. Certainly it's a expensive national health problem, but also think about the amount you spend on your co-pays for your medications and the time where you miss work because of health-related problems from your weight. So what are your options? Certainly, you're looking at this, so you're thinking about weight loss surgery, but what are the other options available to you? First of all, there's dietary intervention, which, as I stated before, typically you can lose about 10% of your body weight. The interesting thing is that's usually not sustained weight, so it's not as though you lose 10% of your body weight and then go on to 20%. Typically, you lose about 10% of your body weight only to regain that weight over time. And so most of the people I see in my practice sort of feel that they're a failure because they've not been able to achieve their weight loss goals with dietary intervention, but this is really the norm. In terms of physical activity, what we found is that physical activity can improve your general health, and we're certainly promoting physical activity for our patients, but it typically doesn't get significant weight off. My idea with that is that using surgical intervention to achieve some initial weight loss can allow you to increase your physical activity. So it's something we talk about with the practice. However, I do not push on that right from the very beginning. However, once you've lost 30 to 50 pounds, you will find that your knees feel better and that you have more energy to increase your activity level. In terms of behavior modification, I think that's actually what we do in our program. There's a lot of follow-up with gastric banding surgery, and I think that that's in part to help with behavior modification because essentially a person can overcome any surgical intervention, and weight regain is always a concern, so we have to actually make long-term lifestyle changes. It's not easy, but the rewards are tremendous. Drug treatments are typically short-term solutions, and while they are effective, a lot of people cannot tolerate medications for a long period of time. Once the medications are discontinued, then people regain their weight. So that again is maybe a short-term solution, but has not been proven to achieve long-term sustained weight loss. So interestingly, the only thing available at this point in time that shows that we can achieve long-term significant weight loss is obesity surgery. And I'm hopeful that that will change at some point in the future, but that is still the best option for obese patients. Now, this is based, kind of on personal opinion, but I think one of the problems with diet and exercise is that over the years, portions have gotten bigger. Certainly, there's multiple components to dieting. Portion size is one of those things, and then food choices is the other. Where the band surgery is very effective is in reducing your portion size, which of course reduces your calorie intake. Here's something where you think that you were, starting the day out with a healthy breakfast, maybe just a muffin with a little bit of butter on it, and you have your latte. And what we find is that the chance that you're going to lose any weight on that day is almost nothing. Our patients utilizing band surgery typically consume 12 to 1,400 calories a day. And with that amount of calorie intake, the weight loss is still only typically 1.5 pounds to 2 pounds per week. So again, over the years, the portions have gotten bigger, and as we've eaten bigger portions, our stomachs have become stretched, and a lot of my patients tell me that they just do not feel satisfied with a normal sized meal. So what you need to ask yourself is your excess weight impinging on your lifestyle? Do you have trouble, just doing walking and climbing steps? Do you find that you're tired and don't play with your children like you'd like to? Do you find that you don't go and work out after work, go for that walk just because you're too tired? If the answer is yes to that, then you really should think about what your options are. This slide essentially summarizes what I've said up to this point, which is unfortunately that when people diet, they're able to lose weight, and whether it's strictly behavioral therapy, diet alone, or combined therapy, once the treatment stops, once you stop the diet, typically you're going to regain your weight. So if you feel like you lost 20 pounds over and over again, only to gain 25 pounds each time you stop dieting, that is very typical. So who qualifies for weight loss surgery? We're not talking about weight loss surgery for people that need to lose 20 pounds. One of the things that we use to assess whether you're a candidate for weight loss surgery is called a body mass index. It is essentially a height-weight index. It's very easy to determine, and if you don't know what your weight index is, the easiest way to check that would be to go online, put in body mass index, put your height and your weight in there, and it'll give you your body mass index. So we're again looking at people who fall into the obese category of a body mass index of 30 or above. Now the interesting thing with that is that band surgery is the only bariatric surgery method that's proven for a body mass index of 30 to 35. Typically what we'd like to see is that there are some what we call comorbidities with that, which are other health problems, such as the things we've discussed like diabetes and shortness of breath, cardiac disease, hypertension. Above a body mass index of 35, typically the weight itself is considered an enough risk factor that you could certainly consider band surgery at that point in time. And as I just stated, lap band surgery is effective in lower body mass index patients. One of the things that individuals don't realize is that 50 or 60 pounds of excess weight can cause significant health issues. And the band surgery, with its safety profile and its reversibility, has been proven to be a very good option for people that need to lose smaller amounts of weight. So in terms of bariatric surgery options, certainly we have the adjustable gastric banding that we've talked about. We have gastric bypass surgery, which has been around for quite some time and for many years is considered the gold standard of weight loss surgery. And more recently, the gastric sleeve resection has become a very popular weight loss surgery. Both the band surgery and the sleeve gastrectomy are both restrictive procedures. There's no malabsorption component, so the weight loss is slower with both of those procedures, but probably with an increased safety profile. The thing that attracts most of my patients to band surgery is the safety profile and the reversibility. And so if you look at this slide, you'll see that the complication rate with adjustable gastric banding is significantly lower than any other procedures available at this time. Gastric bypass surgery has its advantage in rapid initial weight loss, that there's no implanted device, and there's a long experience in the United States. However, the operation is somewhat complicated with stomach cutting, stapling, and intestinal rerouting, and there's definitely a higher complication rate and mortality than with band surgery. The other thing is to consider with this is that this is typically a difficult to reverse procedure, and it's not adjustable. So if this is an option that you're considering, you have to remember that you're making a long-term commitment to this procedure. As you can see with this gastric bypass procedure, again, a small stomach pouch is created by transecting the stomach, and then a portion of the small intestine is rerouted, which again leads to some malabsorption, and this is the reason that you can have rapid initial weight loss with this procedure. The sleeve gastrectomy has become very popular. It also has fairly rapid initial weight loss, and there's no implanted device required, and so you don't need to do the follow-up with the program as you do with the band, because essentially there's nothing to adjust after the surgery. However, this is often portrayed as a minimally invasive procedure, and yet approximately 80% of the stomach is removed with a sleeve gastrectomy, creating a long staple line, which can lead to some complications. The other difference between this and the band surgery is that this is not a reversible procedure. And finally, this is not adjustable. So if you find that you continue to have hunger issues or portion control becomes a problem with gastrectomy, a more aggressive surgical option may be required. Again, the sleeve gastrectomy is simpler than gastric bypass surgery, with a staple line being created just inside the greater curvature of the stomach, creating a small stomach tube, which is essentially 20% of its original size. This creates early satiety, which is a sense of fullness with a smaller meal. Because there's no bypass, the calories that you do ingest will certainly be absorbed by the intestinal tract. Lap band surgery is a very simple idea. Essentially, there's no cutting, stapling, or rerouting of the intestines. There's a small device that goes around the upper portion of the stomach, creating a 4 to 6 ounce pouch in the upper stomach. This band works in several ways. It basically creates a sense of early satiety, which is essentially fullness with a small meal. And when properly adjusted, the band will also suppress hunger between meals. The disadvantage is, because of the fact that there's no malabsorption, that the weight loss is slower. Essentially, the typical weight loss with a band procedure is 1.5 to 2 pounds a week. However, if this is sustained weight loss, then even 2 pounds a week is over 100 pounds of weight loss in the first year following surgery, and this can make a tremendous difference in your lifestyle. Now, regular follow-up is critical for optimal results, and in fact, with my program, we see the patients at least monthly during the first year after surgery, and many of my patients follow up on a regular basis long-term so that their band can be properly adjusted, and this adds accountability and helps maintain sustained weight loss. It's an implanted device, and we'll talk about what that means to you. And while there's less experience in the United States, the band surgery was approved in the U.S. in 2001 and was done overseas in Europe and Australia since 1991. So worldwide, there's been over 800,000 lap bands placed. Again, the lap band procedure is quite simple. It's laparoscopically performed, and typically it takes 45 minutes to an hour of total surgical time. As you see, the lap band is placed around the upper portion of the stomach, but there's no change in the anatomy. The remainder of the stomach sits below the band, and by placing the band high in the stomach wall, it creates a very small pouch. The stomach holds less food, you feel full with a much smaller amount, but satisfied. And this is one of the problems I see with dieting, is that when you are dieting, you're always hungry, and so eventually you're going to not be able to continue with the diet, which will then result in weight gain. I like to approach this surgery as something that's going to help create a long-term lifestyle change for my patients. You know, the benefits of the adjustable band procedure is gradual healthy weight loss. It truly is a customized weight loss program because the band is adjustable, and that's a simple procedure that's done in the office and takes 5 to 10 minutes. However, the amount of adjustments required is different for each patient, and that's why we require the monthly follow-up during the first year after surgery. It does present a sense of fullness with a small meal, and as I stated before, with a properly adjusted band, typically you're not hungry from meal to meal, which essentially puts you in control. As far as the risks with this procedure, certainly there's risks with any surgery, and we do everything we can to optimize your surgical results. Anesthesia is very safe at this point in time, and most of these procedures can be performed in an outpatient center. However, all our patients are screened preoperatively, and if there's additional health risks, then your surgery may be performed at a hospital. Infection rates are low. This is what's called a clean procedure, so it's less than 2%. Although I do typically give my patients a dose of antibiotics prior to surgery because this is an implantable device. Now, the remaining things listed are really kind of interrelated, and so I'd like to kind of group them together in that obstruction, nausea and vomiting, and band slippage are all related. Certainly with band surgery, you need to eat slower and chew your food as there's a narrow opening through the upper portion of the stomach. There are also a few things that don't go through the band very well, such as very tough meats and bread products. Therefore, if you do not chew your food or you choose things that we know are somewhat difficult to go through the band, that can lead to some obstructive symptoms such as nausea and vomiting. And in fact, during the first couple months after band placement, more than likely at some point you may forget to chew your food properly and may have some mild symptoms. However, in a patient that continues to have these kind of problems, as far as chewing and making good food choices, you run a risk of a band slippage. The slippage is actually not the band moving, but a lower portion of the stomach moving up through the band, causing additional obstruction. Often this can be relieved by simply loosening the band, which again is an office procedure. If, however, the band position does not return to a normal spot, then this may require reoperation to reposition the band. This is the most common problem that we've had over the past 8 years of band surgery. However, most of the time these can be handled in an outpatient setting, and out of over 900 patients, we've probably had 30 to 40 band reoperations for slippage. The more significant complication with band surgery is band erosion, and although this does require that the band be removed, incidence of this is quite low, and again, over 8 years, we've only had 4 or 5 band erosions. The main problem I see with this is that if the band is removed, then statistically, the patient will regain weight over time. The final problem with the band is that the band adjustment port, which is implanted in the abdominal wall, can become dislodged and have to be reattached, and on rare occasion, the port can develop a small leak of the sterile saline solution, which means the band will not stay tight. If the port, however, needs to be replaced, this does not require an additional laparoscopy, but only a minor outpatient procedure with a port replacement and can be done in an outpatient setting. Again, contrasting band and bypass surgery, we see that the band surgery complication rates in both total complications, in terms of major complications, and in terms of short-term mortality rate are significantly better. And again, I believe that's what typically brings people into this practice and into this program is the safety profile of the band surgery along with the reversibility. In regards to the reversibility, I would like to say, however, that I want my patients to consider this as a long-term change because, again, if the band's removed, typically the weight will be regained. However, especially in my younger patients, I feel that other weight loss options will be available in the future, hopefully that won't require surgery, and at that point the lap band could potentially be removed. In terms of length of hospital stay and return to normal recovery, most of our patients are done in an outpatient setting as a 23-hour stay and are able to return to work within 5 to 7 days. I think there is some additional fatigue that continues for an additional week following the surgery due to the fact that not only have you had a procedure done, but that the calories are reduced, and I believe that it takes approximately 2 weeks to regain your energy. By that time, you will be back in the practice in consultation with the dietitian regarding diet advancement, and then within an additional 2 weeks, we'll be seen by myself in order that your band may be assessed and your first adjustment performed. Again, comparing band versus bypass surgery, the results long-term are very similar. In fact, we have achieved over a 65% excess weight loss mark with most of our patients at 18 months. So it's really your decision. Again, 3 operations are really available extensively around the country, and that would include lap band, gastric bypass, and gastric sleeve resection. And I think it's very important that you look at all your options, that you talk to people that have undergone these various procedures, that you assess different programs, the strengths and weaknesses of each program in order to make an informed decision. As we've discussed before, to be a candidate for a band procedure, your body mass index needs to be above 30. Certainly between 30 and 35, we like to see additional comorbidities or other health-related problems. I think you can think in terms of excess weight of anywhere from 60 to 100 pounds overweight and beyond as a possible candidate for band surgery. At this point, the procedure is approved for patients 18 years and older, and I would say the youngest patient I have performed this on was 18, and I think at this time my oldest patient was 73, so there's a wide variety of ages that have been helped with this procedure. We like to see that you've been overweight for a few years and that you've tried other things to lose weight in the past. You must be prepared to do regular follow-up, especially in the first year where the monthly visits are required with this program, but this does achieve optimal results. In terms of a few patient success stories, this was one of my very first patients done the very first day that I began band surgery almost 8 years ago, and she had very nice sustained weight loss. That follow-up picture was 6 years after her initial band placement, and so you can see this is about sustained weight loss. This patient is a pastor who basically came into my practice and was very unhealthy initially and had lots of medical issues. This was a patient who one of his parishioners paid for his band surgery as it was not covered by his insurance. The results you see on the right side are an illustration 8 months after surgery with approximately 100 pounds of weight loss. This was one of my early band patients who's now 7 years out from surgery, and she quite often volunteers to speak at seminars and group support sessions for my patients. And she's not compensated for that, but she so strongly believes in this procedure and how it's changed her life that she is really happy to talk to other people about the surgery. And she's a very good mentor for a lot of my patients. This is a patient who essentially has not achieved goal weight at this point in time, but remember that this is a journey, and this is approximately 75 pounds of weight loss. So she is not where she wants to be in terms of total weight loss at that point. However, you can see the difference that makes. As we talked about earlier, we don't push on needing to exercise immediately. It's very difficult for a lot of my patients who carry the excess weight to go to the club and work out. You know, your knees hurt, your back hurts, you're fatigued, but as you lose the weight, you'll become more active, and as you become more active, you lose more weight. This patient became very active in running marathons and triathlons, and actually we did a triathlon together 3 or 4 years after his band surgery. This illustrates almost 150 pounds of weight loss, and this was achieved without requiring any band adjustments. And as we stated, that's why it's a very customized approach. Just a reminder that the band adjustments are done in the office typically and take approximately 10 minutes. You know, philosophically, I tell my patients that the band's a tool. I don't believe that any surgery by itself will help you achieve weight loss that will be sustained long-term without making lifestyle changes. But I want to assure you that my staff and I are with you all the way. We'll have monthly follow-up in the first year. We have many patients that are beyond the first year that still follow up regularly in the practice. We offer group support, dietary consultations in order to keep you on track. And I've seen healthier, happier lives evolve from the band surgery and the behavior modification that goes along with this procedure. I always give my patients all the credit, and I tell them that, I may see you for a half an hour each month, but that leaves 29 days between visits where you have to make the healthy lifestyle changes. But I've seen the tremendous, results that this can have and the lifestyle, that the patients can have after weight loss, and it's been very gratifying as a physician. So the next step essentially is to, first of all, give this some serious thought. It's covered by most insurances, but that's an individual thing, and it's also covered by Medicare. We have specialists within the practice and program that deal with insurance, and so certainly, give us a call anytime if you have questions about that or other questions about the band in itself. If you'd like to have a consultation and talk to me personally about your weight loss issues, we'd very much enjoy meeting you and look forward to seeing you in the near future. We have a very nice outpatient clinic on the Community Health Network Hamilton campus, and we look forward to seeing you in the near future.